I'm Adrienne Pedersen. Today on Upfront, Delta rising. COVID cases spike at a busy time of summer. I'll ask Milwaukee Health Commissioner Kirsten Johnson if this could lead to a new round of shutdowns or mandates. Then, an eviction crisis averted for now. Milwaukee Democratic Congresswoman Gwen Moore on the help available and whether the federal government should be stepping in at all. And how state lawmakers are getting involved in UW system efforts to enact COVID mandates on campus.
Taking on the issues important to Wisconsin. This is Upfront with your host, Adrienne Pedersen.
Hello, and thank you for joining us. The COVID Delta variant is spiking just as we head into some of the biggest events of the summer. State Fair opened Thursday. Summerfest starts next month. COVID cases are rising sharply in Wisconsin. The 7-day average is more than 1,000 cases a day, the highest number we've seen since February, though still far off the peak of last November when the average was more than 6,000 cases a day. Case levels in Milwaukee County are very high, and that has many wondering what the city will do next to curb COVID. We're asking Milwaukee Health Commissioner Kirsten Johnson. Commissioner, thanks for being with us today. You know, I understand that you're in talks with the mayor pretty much constantly, reevaluating what to do next. So what would you say is on the table right now when it comes to changes? Could we see capacity limits, some kind of mask policy? What restrictions could be in our future?
That's a really good question. And you're right, the mayor and I meet almost daily to talk about what our next steps may be. Last week, we issued a mask advisory. And at this point, we are really strongly encouraging businesses to ask people to mask indoors, to have staff mask indoors, regardless of vaccination status. So I think that's our first step. Also recognizing there are people who are becoming symptomatic or even asymptomatic who are vaccinated. So if you're exposed, to get tested.
As we see the numbers recently, especially in the city of Milwaukee, I think it has a lot of people wondering, is another shutdown inevitable?
I can't say for certain. If we've learned anything over the past, year, 18 months, is that things change quickly and the virus is constantly changing. So nothing is certain. I certainly hope that that's not where we have to go. But again, we can't take anything off the table. We are in the midst of a significant increase in the number of cases. Our vaccination rates aren't where we want them to be. Certainly our older population is more vaccinated, but again, we need to do what we can to protect our most vulnerable, our children who are not vaccinated, and our community.
When you look at a place like New York City deciding to require proof of vaccination for restaurants, gyms, and indoor venues, is that something you've talked about at all with the mayor? Is that something you could picture in Milwaukee?
I do think we know vaccination is the way out of this pandemic. I think New York is headed in the right direction. We are actively talking about how to encourage employers to get their employees vaccinated. And as a city, we're also looking at potentially mandating employees to be vaccinated. But what that looks like, it's a lot more difficult than it seems to actually implement. But again, vaccination needs to be the emphasis. Vaccination is a way out of this pandemic. Every single person who's not vaccinated is a potential host for another variant, and we need to avoid that at all costs.
Aside from employees, though, could you see it being for the public if they want to enter an establishment?
I think we're looking at, I know, for example, there are acts, bands that are coming to Milwaukee later this fall who are requiring and asking venues to assure that the people in attendance are either vaccinated or test negative. Similarly, we saw that at Lollapalooza last weekend in Chicago, that the requirement was that people were either vaccinated or had proof of a negative test. I think, again, the emphasis needs to be on vaccination, and whatever we can do to increase those numbers, we need to do. So nothing's off the table, but we'll see how this plays out.
And what are the talks right now with Summerfest in terms of requiring proof of vaccination or really any other restrictions?
So we've been working really closely with Summerfest this entire time, and they've been a great partner. Certainly we're not in a place that we hoped we'd be in a better place coming into Summerfest. I think it's 3 to 4 weeks away, but we've been meeting with them consistently. We're meeting again with them this week. We really want to make sure that the Summerfest is a safe event for everyone in attendance.
And after seeing what happened with the Bucks, I mean, it really wasn't shocking to know that officials are saying 491 people with confirmed or probable causes after attending the Deer District or different types of Bucks events. Knowing that, do you feel like we should go ahead with Summerfest?
So, it's interesting. I think we've known this all along. When people gather, the virus is going to spread. So any large gathering, there's going to be spread of the virus. If you look at the actual number of cases over the course of the month of July in Wisconsin, the spread from the Bucks event specifically is literally less than 5%. I'm not trying to downplay it. Again, when people gather, we see the virus spread. But as a total of the whole, Delta was spreading in Wisconsin well before the Bucks started having their events at the Fiserv Forum or even in the Deer District. As people gather, we're going to see spread in those groups.
So you don't foresee Summerfest being canceled at the last minute?
I don't foresee that.
And when it comes to our next few weeks, what does it look like now in Milwaukee? What do you think the numbers will look like based on the models you're seeing?
So I think we need to anticipate that our numbers will continue to climb. We know Delta is very contagious. It is the predominant variant in Wisconsin and certainly in Milwaukee. I think the last numbers I saw was about 90% of the total number of tests that were sequenced were Delta. So again, we know it's contagious, we know it's here, and we know that it's spreading. So I would anticipate at a minimum for the next 20 to 30 days, we're going to see an increase in the number of cases in the city of Milwaukee. So again, really encouraging people who are not vaccinated to get vaccinated now. And to wear masks when indoors.
And when you say an increase, do you have any idea how much that could be?
No, we had done some modeling last week. A week ago, our burden rate was in the 70s. I anticipated it doubling in the subsequent week, and we more than doubled. It was at 195 on this past week. So we know it's increasing rapidly.
And last question, I think as people look ahead and wonder if there will be any kind of limits on small businesses going forward, they say, how could you consider that when you have huge events going on locally, like State Fair, that's not in Milwaukee, but in the area, the Bucks events, Summerfest, all those Brewers games, and then be trying to figure out how to crack down on businesses?
So I hear that. I hear you. I hear our business partners loud and clear. I think the message I have is we all know how to do this safely. Many of our businesses put forward safety plans last year. We're asking them to lean into those again. And again, we know masks work. So if we have everyone masked indoors, we will really limit the spread in spaces. But again, I want the focus to be heavily on vaccines at this point. We need more people to be vaccinated so everyone's protected and we don't see our hospitalizations go up or our deaths go up, frankly.
Okay. Health Commissioner, thank you.
Thank you for having me.
The commissioner also told me if you're not vaccinated, she thinks you should reconsider attending the state fair. Coming up, new help for people under the threat of eviction. I'll ask Congresswoman Gwen Moore if what the Biden administration has done is legal. And later, new rules for the UW system as it works to curb COVID on campus.